Welcome back. You're watching McLaren Port Huron's Today's Health. And in this segment, we're going to be talking about Lyme disease. And we're talking with infectious disease specialist, Dr. John Brooks. What is Lyme disease?
Well, Lyme disease is an acute bacterial infection. It's, again, a very interesting infection because it's not very common here in Michigan. Michigan, we would be declared a emerging state. Lyme, it's an interesting name, right? Lyme, where do they get that from? Well, Lyme, Connecticut. There's a lovely community in Connecticut. Its name is Lyme, and that is where the researchers found this new infection that they found basically in the 1970s. So it's a bacterial infection that is pretty invasive to human beings because it can invade a lot of our tissues. It can invade your heart, your brain, your connective tissues. So it can really infect a lot of different things. Lyme disease is unique in that it can affect most people. There's really not anybody that's uniquely immune to it. And it is something that we get from the environment. So by that we mean is that we get it from tick bites. So the Lyme bacteria, it's got a lovely name, Borrelia burgdorferi, is carried by a tick. It's the black-legged tick called the Idoxides tick. So those little guys live in the environment, and we as people who want to go out camping and doing all those wonderful things we do on this lovely planet of ours, we can get bit by ticks. If we do have a tick bite, it can then transmit the bacteria to us. The bacteria gets into our system and then can invade our tissues.
Now you have a slide that shows us what our risk is here in good old St. Clair County, Michigan.
Yes, and I kind of brought that on purpose. This is right from the Michigan Department of Community Health, looking at our state. We are an emerging state, meaning that they are finding some areas where Lyme is occurring and finding it quite easily in persons that are there that don't have travel. Because let's say tomorrow I want to go out to the East Coast and I get Lyme disease, well, okay, I went to the East Coast, it's endemic there. It lives in that environment. It hasn't been all that endemic in our state for a long time. We know up in the UP, up by Wisconsin, it's been there for a lot of years, but we're seeing now in the coastal part of Michigan along the Lake Michigan shoreline that we're seeing some Lyme there. But here in our hometown of good old St. Clair County, fortunately, we do not have Lyme disease endemically here.
What are the symptoms of Lyme disease?
So Lyme disease, when we're first infected with it, causes a unique rash called a target lesion, a bullseye rash. So the target sign, a little dog, target. It's a red rash that expands and the center clears. And so that's why they call it a target. That's the first thing. And then we get basically symptoms almost like the flu. We have malaise and fatigue. We get some body aches and we feel quite poorly. A lot of people also feel depressed. There's a neuropsychiatric component to it, is they just feel terrible. They just feel like somebody took their energy away. Most people get over it, but Lyme disease can become more chronic. And that's really one of the worst problems with Lyme disease, is that if it chronically becomes an infection, it can be of our organs, especially of the heart and the brain. And those chronic infections can be quite debilitating.
How do you make the diagnosis of Lyme disease?
So Lyme disease is a clinical diagnosis almost all the time. So somebody's been out camping, they come to you and they have a target bullseye lesion on their back, their arm, their leg where they got bit at. You'll clinically say you probably had Lyme disease and we can give them antibiotic therapy. The erythromycin type antibiotics work very well and they're highly effective. However, if somebody doesn't know they have the lesion or they didn't see it, because not everybody gets that characteristic rash, about half. So if people then have symptoms that are characteristic of Lyme, we have some blood testing that we can do. Now, regretfully, blood testing is not great for Lyme disease. It helps a bit, and when it's positive, it's quite helpful to say, yes, I think they have Lyme. But in general, Lyme disease remains an infection that is clinical. So if somebody has potential exposure, they've been to the right places, they live in the right places in Michigan, and they have a disease state that's characteristic of Lyme, we'll think they have Lyme and then we can treat them. Fortunately, Lyme is treatable with antibiotic therapy. For minimal Lyme, which is early Lyme disease with just the rash and minimal symptoms, things like erythromycin and doxycycline were great. When people get more sick, if it's involving their heart or their brain, they need antibiotic therapy that's parenteral, which means IV. And we can use a drug called Rocephin, which fortunately works very well in eradicating the infection.
Can you cure Lyme disease?
Yeah, we can actually eradicate it, yes. Now, the difficulty comes in persons that have Lyme disease that's been not diagnosed for quite some time. Then they can really get what we call like a Lyme syndrome, where they really feel poorly. They have chronic fatigue, they have no energy. If it's involved their heart doesn't function well, and they don't have energy. They don't have the ability to do a lot of exercise. They just don't have any oomph anymore. They feel quite poorly. If it infects the brain, it affects brain function. So they lose sharpness of thought, they lose clarity. They can actually almost start to act like a dementia and really have some troubles.
Sounds like it might be kind of difficult to diagnose, though, when you're talking about those symptoms. Once that rash is gone?
Yes, it is, and that's the difficulty. And since we don't have really terrific blood testing, it becomes somewhat difficult. So what we often do in the medical world is that we have to take a good history, see where people have been. Is there a chance they've been to places where Lyme is endemic? And do they have a history that sounds like it could be Lyme?
Can you prevent Lyme disease?
Well, in animals we do. There's a vaccine for Lyme in animals, so your dog and your horse can get a Lyme vaccine. In people, several years ago, they tried a Lyme vaccine and went through a trial. It didn't go well. So as of right now, we do not have a vaccine for Lyme disease. At some point in time, we may again. They are working on that. But as of right now, there's no true preventive as far as a vaccine. However, if I'm going to go out camping and I put on some bug spray, if I put on, some good off, then guess what? The ticks don't want to bite me, and I'm not going to get Lyme disease. So if you wear good clothing when you're out hiking, something that covers your body, that's good. Kind of hard to do when it's 90 degrees out, and that's where insect repellents are very helpful because they will help you not get bit.
Is it important for parents to look at their kids? How often do people actually find that little tick?
So, we can talk about the tick a little bit. The Ioxidase tick is not what we usually see on our dogs. If your dog goes out to the field and come and you see a tick that comes off and it's a tick, it's big. The Ioxidase ticks are quite small. If you take your pen and you make 2 points, that's about the size of the Ioxidase tick. So it's very small, it's very pinpoint and difficult to see. So it's really hard to see it on us or on our children.
Better to try to prevent it with the spray.
Yes.
And just be watchful. This has been such great, clear information. Do you have any closing comments for our viewers?
Well, one of the things that's really important is to remember that vaccines are very important. They help us prevent many, many infections. We've talked about measles and the MMR vaccine, how important that is. We talked about shingles and a vaccine for that. So keep in mind that vaccines can really help us.
Thank you so much for joining me.
Thanks, Barb.
And thank you for joining us. We've given you a lot of great information today, and if you have any questions about it, please call us at Health Access. That's 1-800-228-1484. You can always go to our website and get great information, or even watch a segment of this program again, or order a copy of the program, and that's mclaren.org/PHTH. Join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, a leader in healing and your partner in health. There we go.
That was good.
And we did it.
You got your whole you got that back down.
I did. I got it back down
Don't
to
go
it.
anywhere, Barb. I got a little fix.
Okay, little fix.